Contraceptive pill. The combined oral contraceptive pill, often referred as the birth control pill or colloquially as the pill, is type of birth control that is designed to be taken orally by women. The pill contains two important hormones, progestin and estrogen. How to use oral contraceptive. The standard way to take pill is to take one every day for 21 days, then have a break for 7 days, and during this week you have a bleed period time. You start taking the pill again after 7 days. The advantage and disadvantage of contraceptive pill. The possible effects of using contraceptive pill. Transdermal patch. A transdermal patch is a patch that attaches to your skin and contains medication. The drug from the patch is absorbed into your body over a period of time. Ways of how to use transdermal patch. The advantage and disadvantage of transdermal patch. Vaginal ring. Vaginal rings are polymeric drug delivery devices designed to provide controlled release of drugs for intravaginal administration over extended periods of time. The ring is inserted into the vagina and provides contraception protection. Vaginal ring comes in on size that fit most women. Ways of how to use a vaginal ring. The advantage and disadvantage of using vaginal ring. The side effects of using vaginal ring. Subdermal implants. Subdermal contraceptive implants involve the delivery of steroid progestin from polymer capsules of rods placed under the skin. The hormones diffuses out slowly at a stable rate, providing contraceptive effectiveness for 1 to 5 years. Ways of how to use subdermal implant. The advantage and disadvantage of subdermal implant. The possible effects of using subdermal implant. Hormonal injection. The contraceptive injection prevents pregnancy by injecting a synthetic version of a hormone's progestogen called dimethylhydroxyprogesterone acetate or DMPA. The injection is also called depot. Depot prevents the body from producing its own hormones, eggs from the ovaries. Ways of how to use hormonal injection. The advantage and disadvantage of hormonal injection. Side effects of hormonal injection include weight gain, headaches, mood swings, breast tenderness, and irregular bleeding. Your periods may become irregular, heavier, shorter. Intrauterine is a device that fitted inside the uterus and physically preventing the implantation of fertilized ova. Ways of how to use intrauterine device. The advantage and disadvantage of using intrauterine device. Chemical barriers. Chemical barriers destroy pathogens on the outer body surface, at body openings, and on inner body linings. Sweat, mucus, tears, and saliva all contain enzymes that kill pathogens. Urine is too acidic for many pathogens, and semen contains zinc. The advantage and disadvantage of chemical barriers. Diaphragm. The diaphragm, located below the lungs, is the major muscle of respiration. It is a large dome-shaped muscle that contracts rhythmically and continually, and most of the time, involuntarily. Upon inhalation, the diaphragm contracts and flattens. The advantage and disadvantage of diaphragm. Cervical cap. The cervical cap is a form of barrier contraception. A cervical fits over the cervix and blocks supermarket from entering the uterus through the external orifice of the uterus. Way of how to use cervical cap. The advantage and disadvantage of using cervical cap. Possible side effects of using cervical cap. Male condoms. A condom is a sheath-shaped barrier device used during sexual intercourse to reduce the probability of pregnancy or a sexually transmitted infection. Ways of how to use a male condoms. The advantage and disadvantage of male condom. Side effects of using male condom. Female condom. This is a thin plastic pouch that is open on one end. The closed end is placed inside the vagina. The condom then lines the walls of the vagina and prevents supermarket from getting into the vagina. The female condom also protects against STIs. Natural methods. Abstinence. Abstinence is simply not having sexual intercourse. If you're abstinent, it means you've decided not to have sex. This includes vaginal, oral, and anal sex. Abstinence prevents pregnancy by not giving opportunity for semen to enter the vagina. The advantage and disadvantage of abstinence. Calendar methods. Overview. The rhythm method, also called the calendar method or the calendar rhythm method, is a form of a natural planning. T9 use the rhythm method. You track your menstrual history to predict when you'll ovulate. This helps you determine when you're most likely to conceive. Advantage and disadvantage of calendar methods. Basal body temperature. Basal body temperature is the lowest body temperature attained during rest. It is usually estimated by a temperature measurement immediately after awakening and before any physical has been undertaken. This will lead to a somewhat higher value than the true BT. The advantage and disadvantage of basal body temperature. Cervical mucus method is a technique used in natural family planning. It involves tracking changes in your cervical mucus. A fertility awareness method used to predict when a woman might be fertile. The method uses body temperature and other signs and symptoms of ovulation. The disadvantage of symptothermal method. Possible side effects of symptothermal method. Ovulation detection. There are several ways of detection ovulation, including urine test kits to measure LH levels, transvaginal ultrasound, endometrial biopsy, blood tests to measure hormone levels, and the basal body temperature BT. Ways of how to use ovulation detection. The advantage and disadvantage of ovulation detection. Coitus interruptus. Coitus interruptus, also known as withdrawal, pulling out, or the pull-out method, is a method of birth control in which a man during sexual intercourse. The advantage and disadvantage of coitus interruptus. That was all the artificial and natural methods. Thank you.